Morning, good afternoon, everyone. Welcome to the second panel discussion of Apec Net's flagship project this year, MedTech Health Services. Today, we are very privileged to have with us speakers from across the Apec region to speak on diabetes management and the role that MedTech solutions and services could play in the ecosystem. We have an exciting program this morning. Benish will introduce the project, followed by a fireside chat by our LEK partner, as well as our product and business leader from Apec. After which we have a panel discussion with a range of stakeholders in the healthcare ecosystem, such as our endocrinologist expert. We have a patient advocate. We have industry leaders who will share about the innovations in diabetes management solutions. And finally, we also have a payer from Singapore to share on how preventive care is leading the way in chronic disease management. Please feel free to type in your questions in the Q&A function at the bottom of the screen, and the Q&A session at the end, we will invite all the panelists to come back online to address your questions. There will be a call to action where we invite our panelists to share with our attendees on one takeaway that they would like to see towards a more integrated and more sustainable healthcare system. Finally, we'll close the event and share our next steps in this year-long journey. Before we begin, a short introduction to Apec Net. We are a regional trade association representing manufacturers and suppliers of medical equipment, devices, and in vitro diagnostics. And we also partner with other key stakeholders in the medtech industry in Apec. And our aim is to improve the standards of care for our patients through innovative collaborations, such as this one, to jointly shape the future of healthcare in the region. Our key strategic pillars are access, to improve access to high-quality healthcare through close collaboration and the wider ecosystem to shape policies that truly impact the lives of our patients, to innovation of technologies and models, and finally, harmonization with international best practices to promote speed to market. A working definition of health services. So traditionally, health services are formally organized as systems of established institutions and organizations to supply services that responds to the needs and demands of populations within a defined financial and regulatory framework. In this project, we are looking at MedTech's role in this definition in its provision of services and solutions targeted throughout the care continuum, be it prevention, diagnosis, treatment, or cure, or palliative care, and the settings may be inpatient, outpatient, or home in response to the needs of the population and within defined financial and regulatory frameworks. So without further ado, Benish will trigger a poll to help us better understand the stakeholders that we have in today's session. Over to you, Benish.
Thank you, Glenda, for the great opening. Before we move on, let's get to know our audience a bit better. So I'll be launching a poll where you will see 9 options to choose from. The question being, what is your primary professional role? All of you are requested to please choose one option and please submit those poll results as soon as you are done. Thank you. In the meantime, for those of you who have already answered the poll question, I would request for Glenda to move to the next slide so we can have a look at the QR code on the screen. This is the QR code for our health services paper. You can download it in not only English, but we are happy to share with you in Korean and Mandarin versions of the paper as well. This paper was launched in January. As you can see, it's called Health Services in APAC, Opportunities, Challenges, and Paths to Progress, Insights from MedTech. It provides a great framework for mapping the evolving landscape of health service delivery for MedTech. Now, I would like to share with all of you the poll results, which we have gotten now. Let's have a look at the poll results. So this is quite interesting. Of course, we have a majority from medtech professionals who are attending the session, but we also have some attendees from some of the gatekeepers of healthcare professionals who have actually joined us today. So very happy for them to join. Welcome all of you. We also have some hospital administrators and some percentage of one of the most important stakeholders for us in this healthcare ecosystem, which is the patient. Thank you all of you for joining us today for this session. Before we go on to the fireside chat, which would be our first session for the day, allow me to take you through our journey on this project so far. The impetus for this initiative came from our members last year when they highlighted about the growing their services and solutions in non-traditional settings of care through digital platforms. With the growing recognition of unmet needs in targeted patient segments, new stakeholders such as medtech companies have stepped up and pivoted into new care delivery models. The pandemic has galvanized the thinking on how models of care must be fundamentally redesigned. As you can see in the slide, with a CAGR of 10% and a global share of 60 billion USD, medtech's new frontier is health services. MedTech, given its expertise in R&D, familiarity with the hospital procurement system, it is uniquely positioned to bring its innovative culture to help support the efficiency, capacity, and responsiveness of the healthcare systems. In the next slide, you can see this discussion may be new, but MedTech has been active in this space for a very long time, as we can see in the mapping of the companies which are active in these areas. Among the universe of health services, we focused on clinical care delivery services, and we engaged our knowledge partner, LEK Consulting, to understand the key areas where our companies have developed solutions using the 4 key archetypes to understand the landscape better. In January, we held a discussion on a critical but often neglected component of care, which is patient and physician education, which is the first category which you can see on the slide. We try to understand the challenges faced by chronic kidney disease management in patients and medtech's role in service delivery for this disease area. The other category which you can see here is clinical operations and analytics, which essentially talks about patient experience management, big data analytics. And the next category which you can see, which is the one we are going to deep dive into today, is care coordination services, which includes applications, clinical decision support for self-management, end-to-end care in chronic disease management, such as diabetes. The last category, which you see here, is direct-to-patient clinical services. When we talk about step-down chronic disease management beyond the 4 walls of the hospital, hospital-centric systems, as we know, as highlighted even more so by the crisis, may be inherently capacity constrained, which may lead to delay in the management of some of the non-urgent cases impacting patients with long-term care needs. And in this category, we see a lot of renal dialysis clinics, rehab, which are directly being delivered to the patients. As we move on, let's move on to the topic for today in the next slide, which is why are we discussing care coordination, particularly in a chronic disease like diabetes? Now, as we know, diabetes is a complex chronic disease that requires an integral and multifaceted approach to ensure adequate control with minimal complications. More people died in 2021 from diabetes than from COVID, with 1 person dying every 5 waking minutes. A patient with diabetes, type 1 diabetes, spends about 3 hours a year with a healthcare practitioner, which means that the rest of the 8,757 hours, they have to manage the condition by themselves. Diabetes is a rapidly changing condition. Type 1 diabetes patients have to make 1 decision every 5 waking minutes. There are different needs of the patients and their care teams along the disease journey that have to be considered, and they require personalization of care. Diabetes management represents complex interventions that require an intricate interplay of different stakeholders and technologies. This ecosystem of digitally enabled care coordination services, which you can see, such as telehealth consultation services, connected glucose monitoring solutions, smart insulin delivery systems, health coaching applications, they are key to deal with this rising epidemic of diabetes, which is why we are here today with representatives from different stakeholder groups to further understand about the challenges and hear how this range of digitally enabled health services can help address some of the current challenges and how they can help overcome these challenges for a more sustainable health system. Without further ado, let's begin the program. Allow me to introduce our two people who have joined us today for our fireside chat. We have today with us Peter Kalikias, who is the Regional Director of Australia and New Zealand at Apec Diabetes Care. Apart from Australia and New Zealand, Peter also has a vast experience from across the region, including Southeast Asia, Korea, Taiwan. Thank you, Peter, for joining us today. We also have with us Calvin, who is a principal at LEK Consulting. LEK Consulting has been our knowledge partner for the white paper. Thank you, Calvin, for joining us today. So let's begin with our session. Peter, firstly, yes, thank you again for joining us today for the fireside chat. My question for you would be that as a business leader, do you see service development for medtech companies as a growth area?
Thank you, Benish, and thank you for inviting me to the seminar today. And the simple answer to your question is yes. We all know that an efficient and an affordable healthcare service delivery to everyone is a prerogative of every government around the world, especially in APAC. To maximise the efficiency and the capacity and the responsiveness of healthcare systems, medtech can directly drive and enable innovation in the delivery of health services. And importantly, as you mentioned earlier, the opportunity lies not simply in delivering a product, but in delivering a solution. That's a key call out that you made earlier. As the when and the where and the how of care is changing, patients are receiving medical care and health data multiple times a year, as opposed to once or twice a year historically. And as you mentioned earlier, with COVID, we've seen the emerging use of telehealth and remote monitoring. Whilst we've been born out of sheer necessity, it's actually changing the landscape for the long term. So with all the above and what you showed earlier, healthcare professionals, and I know there's someone on the call here today, of all fields can better administer care outside of traditional clinical settings. And thanks to innovations such as wearable technology, which you mentioned earlier, patients are able to view and track the medical data and adjust their treatments and behaviours as they do. So importantly and very critically, data and analytics now being viewed as an asset to create value. And I'm sure we all agree that more effective use of data will drive better outcomes for everyone, whether it's the patient, whether it's the healthcare professional or the payer. So whether it's clinical education services, whether it's care coordination services, whether it's clinical operation analytics or direct-to-patient care clinical services, there's definitely an opportunity. Patient coaching, for example, on product use and upskilling of healthcare professionals, clinical education services, a critical but often neglected component of effective care delivery. For patients, clinical education services help augment the efficacy of existing treatment modules and improve patient treatments and post-charge treatments too, and also adherence management. And empower patients are equipped to actually engage in shared decision-making with their clinical team for appropriate care. So in summary, there is this opportunity, and it lies there for medtech companies to work closely with healthcare providers to not just deliver the equipment, but also innovative services. And this is often enabled with software that meet the specific provider needs. So what we say beyond the product, collaborations offer significant opportunities for everyone on this call.
Thanks, Peter, for sharing that. It's interesting to know from your perspective how this expansion into services is there, where there's actually adequate demand and adequate resources actually also available to continue supplying these services. I would also like to ask you, of course, we know this expansion is happening. Why do you think this is a priority for the industry now?
Yeah, it's a good question. And I think, if I encourage everyone to read the white paper. There's a lovely paragraph in there that talks about the, given the increase in the prevalence of non-communicable diseases, the aging population, the emerging middle class demanding high quality care, especially in this APAC region, there's this clear need for leveraging the deep, and I'll say global expertise of medtechs to augment and accelerate the development of health service provision in health systems across all of Asia. And whatever the apprehensiveness there might have been previously, one important outcome of the COVID-19 pandemic, as I mentioned and you mentioned earlier, has been, I'll say, this near insatiable appetite for more reliable digital and connected diabetes care. And given the sheer numbers of people living with diabetes globally, that's 400 million, with a large percentage living in our region, unfortunately, it talks to the impact of non-communicable disease. For example, where I work at Abbott, our diabetes care business is really at the forefront of diabetes management, and we're deeply integrated into and involved in with the services with both healthcare professionals and people living with diabetes, both here in Asia Pac, but also globally. An example of this is obviously our life-changing continuous glucose monitor, which is really more than a product. As we say, it's a system that incorporates apps, allows patients' data to be more visible to them, to the healthcare professional and their loved ones. And what that's doing, CGM is driving a new model of care through innovative service model for diabetes care. So it's not just the product per se, it's that connected system with the healthcare professional, with the payer, with the patient, that's actually changing the model of care of diabetes. And it's driving improvements in treatment, but ongoing management of people living with diabetes. And I think this is part of not just Abbott's, but in general, medtech's commitment to connected care technology, as you mentioned earlier. It's intended to put people in control of their health and facilitate better communication with their doctors and with the healthcare professionals. And so the apps that we're seeing out there at the moment, including Freestyle Libre, is able to provide doctors and their staff and the patients with a shared view of their glycemic profile. And that's something we never ever had before, and it's becoming a priority now for us as an industry to really push the value of that. And in turn, this helps healthcare professionals understand where their patients are on in their journey, how patients are responding to the therapy, to better inform their treatment plan. And again, this is a major goal, I think, for all of us here within MedTech to drive that connected care approach. As I mentioned earlier, the apps that we see out there allow HCPs to be better connected with their patients and see where they're in the process, see how they're doing, share critical and clinical data with their colleagues, and ultimately facilitate more efficient consults, which we know is a priority for a lot of healthcare professionals because they're so time poor. So ultimately, it allows for better use of the critical time of the healthcare professional and really drives the empowerment of patients' self-care to drive better health outcomes.
Thanks, Peter. Thanks for highlighting that digitally enabled ecosystem, which is actually being provided by the medtech companies. Please hold that thought. We'll come back to you to share some of your experiences from across the region. I will now turn on to Calvin. Calvin, it has been a wonderful journey for Apec Net with LEK Consulting on the white paper. Our goal, of course, as you know, was to first understand the landscape, identify the challenges and the opportunities in this innovative business space, which some medtech companies may be new to. Could you share with us some of the key findings for the service category of care coordination services?
Sure, thanks, Venice. So care coordination service is one of the health service offerings from MedTech to support and complement the care delivery by the traditional healthcare providers, which enable more seamless and more coordinated care for patients through the use of digital health technology. So now there are different types of care coordination services, as you see on the slide, that basically covers the entire continuum of care, from early stage patient identification and monitoring, telehealth services, post-acute care optimization management, as well as the population health management service. Before we go into, I think, just to provide a bit more color around each of these, it's probably interesting to hear a bit more from the audience as well to see which type of service, care coordination services that they are most interested in. So there's a poll, and each of you can basically identify the segments that you're interested in. So a bit more explanation, I guess, in terms of the type of services in each of these categories. So the early stage patient identification and monitoring, for example, here we are talking about solutions that are targeted towards like healthy individuals or someone with certain risk profiles of developing certain diseases. And the solutions here revolves around helping them to identify and monitor certain risk factors. So there are a lot of developments around like connected apps, wearables that basically help support or deliver the solutions around that early stage patient identification and monitoring. And then the second category, as we move to the right, is the telehealth services, which everyone has seen accelerated development in this space after COVID. So these services connect patients with the healthcare providers or the clinicians, not just for consultation, but there is also a new development around the remote monitoring of patients' conditions through connected apps or wearables, for example. Then the third category is around the post-acute care optimization or management. This includes services that allow doctors to or providers to basically optimize the patient care outside of the traditional care settings, outside of the hospitals or clinics, which basically help to help basically alleviate the patient load or burden at the hospitals, but also optimize the patient care journey as they get moved out to the outside of the acute care settings, for example. The last category is the population health management service. I think for this is quite recent development in terms of conducting health surveillance to help the healthcare system react more promptly towards some of the epidemic, for examples that are happening. And we've seen some of the examples or development in this area, not just in chronic care disease management, but also in the COVID-19 pandemic as well. So Benis, I think it'll be interesting to see what the poll result is on the care coordination.
Yes, Calvin. So we have the results of the poll out. Thank you everybody for participating. We have some interesting results from the audience poll. I believe, of course, telehealth is something which would be of interest for the participant because its adoption was accelerated by the pandemic. But what I actually see the most interest for the audience is in the area of early stage patient identification and monitoring. So Calvin, what do you have to say about the results?
I think the result is, I think it's pretty much, I think there's a lot of interest in the early stage, and we see a lot of the development in the connected apps, the wearables in terms of helping patient identifying some of those risk factors, which I think we are going to touch some of that during our panel discussion today to see there are some things in development specifically for diabetes. We've also seen development of apps that help like basically identify any risk factors associated with cardiovascular diseases as well. So I think it's an interesting area. I think across all of these, there is a lot of like developments happening on care coordination. So I think that's a quick thought on that. I think as we move on, as we talk about the care coordination services in terms of what benefits as well as what challenges it has in terms of like delivering this to or providing this care to a patient, there are plenty of benefits that we've seen in terms of facilitating that seamless care provision between a healthcare providers or doctors to patients across the continuum of care. And one of the great examples on these was around the use of remote patient monitoring for chronic disease. We've seen some of these development that Peter mentioned around that continuous glucose monitoring system that helps monitor the patient progress. And there is also a lot of help that the patient will be getting from these, especially during COVID, especially with these patients with chronic disease. They are more they are considered as a high-risk group that has higher chance of getting that severe COVID, for example, that will benefit from some of these remote monitoring services to optimize their care outside of the traditional care settings. There is also, I think, the questions around why the adoption has been actually quite challenging that we uncovered during the paper as well. So in APAC, we've seen a diverse set of markets with a very unique healthcare ecosystem, infrastructure as well that is quite different and unique to each market. The differences in each market make it operationally challenging and require companies to tailor fit the service offerings to meet the local infrastructure requirements. We've also seen during the paper in terms of the differences in terms of economic appetite to reimburse or fund such services across markets in Asia Pacific, because I think we have different kinds of development, different level of like development in terms of like healthcare infrastructure across Asia Pacific, and there is different economic circumstances that each country is dealing with. And there are also like some of the more recent challenges that people may have heard about around patient data privacy. How do we ensure there is appropriate access to the data, but also allowing some protections towards patient data to allow doctors to leverage this data in a way that will help them in terms of making clinical decisions, but also protecting the patient. So I think there are a number of challenges that we've uncovered during the paper, and I think it would be interesting as well to hear from Peter's side in terms of some of the challenges that you or maybe other medtech companies you've seen face in terms of driving the adoptions of care coordination services, specifically in the diabetes management space. So that's the first question. And also, I think the second question that I have is around which market do you see most potential in? And also there's that more openness in terms of collaborating with medtech companies on care coordination.
Thanks, Calvin, and two very good topical questions. So yes, despite the tremendous innovation that we're all seeing and have been highlighted earlier, the challenges do remain. There are many examples of the value being generated by the adoption of care coordination, including embedding best practices and upskilling of healthcare professionals with innovative procedures, telehealth, including remote monitoring, etc. However, there's, as you mentioned, there's still many obstacles, as mentioned in the white paper. Clearly, there's room to increase awareness, and however, awareness doesn't necessarily translate into usage. As an industry, as a body, we need to keep showing that the outcomes and benefits that it delivers. And the best healthcare solutions, as we all know, are ones that help the most people, which is why, for example, we designed Freestyle Libre with access and affordability in mind from the very beginning. So therefore, broader access driven by reimbursement will definitely help. We know that. Critically, medtechs face, I'll say, limited reimbursement provisions for supportive care services. And again, it's imperative that we work with payers to help them appreciate and value the benefits that services can provide. We also know that not every healthcare professional is looking at the data that we provide, and not every healthcare professional is looking at all the the CGM data in between patient visits. And this may have to do that, maybe in some countries, maybe they're unaware of the reimbursement for this type of activity, or maybe reimbursement doesn't exist. So, for example, we know now in Australia there's a push for the federal government to allocate more funding to support diabetes healthcare professionals, provide healthcare and education to people who use diabetes technology. So you can see the thinking is evolving to funding of services beyond the product. To your second question, I believe any country in Asia has the potential. As you mentioned, the solution has to be tailored to the specifics of that country, and something that I'm very passionate about. Not everything fits everything in one perspective, so we're going to tailor fit it. But I can confidently talk about Australia as a recent example in terms of where the potential lies, and I think this potential has feet to be used in broader Asia. So telehealth, as you've mentioned before, has been transformational to Australia's universal healthcare and has played a critical role in ensuring the continuity of care for hundreds of thousands of Australians and Australian patients during the COVID-19 pandemic. So protected the health of the patients, but also the health professionals. It offered greater flexibility to healthcare while supporting universal healthcare access during this pandemic. And pleasingly now, this will now become a permanent feature of healthcare in Australia, as subsidised by the federal government. So you can see the evolution that's occurring and the opportunity that's there when the value is shown to the payers. To the point you mentioned earlier, there's also, I say, a need for better collaboration between the public and the private sector. There's room for governments to further engage and collaborate with the private sector to support care delivery, care innovation, and best practice sharing. So the greater use of such PPP would permit governments and payers and healthcare institutions to I'll say tap medtech resources to developing platforms for health service innovations that complement public sector efforts to address gaps in patients' access to treatment. Now, I've seen a few great examples here in Australia, with one being the Western Sydney Diabetes Initiative. So Western Sydney, for those who don't know, is a big diabetes hotspot in Australia, especially with type 2 diabetes. And if the hotspot's not addressed within a decade, it will cause unsustainable economic and societal burden on our government's healthcare system. So the Western Sydney Diabetes Initiative was established in response to this this growing threat of diabetes that's posing to the community's health and also well-being. And what it's done successfully, it actually calls for all levels of government, the private sector, and non-government partners to work together. So critically, they're utilising digital technology, such as smartphone apps, including Freestyle Libre, to help patients and doctors and other healthcare providers share information and better manage diabetes and prevent complications. And I noticed in the survey there was an emphasis on the early diagnosis and then the early management. And this initiative in Sydney is actually doing that via the use of technology from medtech partners, but also leveraging the expertise of government and government funding. So examples such as this, gives me hope that we can overcome the challenges, but it's our role to ensure that we work collaboratively with government, with payers, with healthcare professionals and other institutions to drive the value of the service and why it should be reimbursed and why it drives great outcomes for now, but also for society in the future.
Thanks, Peter. We do believe stakeholder engagement and partnership is important, as you have highlighted, with strong collaborations with the healthcare practitioners, patients, payers, policymakers. And it does have a unique role for MedTech as well in the health service planning towards a sustainable health system. I would like to take this opportunity to thank you for joining us for the fireside chat today from Melbourne. And Calvin, thank you to you as well for your great input. With this, we'll now move on to our next session on the panel discussion. Thank you, Peter, again for joining us. If anybody has any questions for Calvin or Peter, please feel free to also send them across in the Q&A section at the bottom. Now, as we move on to the panel discussion, I'll first introduce our moderator for the session, that is Stephen Sunderland. He is a partner at LEK Consulting, which has been our knowledge partner for the white paper and the ongoing journey as well. Welcome, Steve, to today's discussion.
Hi,
Hi, Steve. We are happy to also, Steve and me are also happy to have a range of stakeholders with us today. We have with us a patient representative from a patient advocacy group, from Korea Diabetes Union, and also from one of the leading global diabetes community, which has been there since almost 1950, which is the International Diabetes Federation, Ms. Gina Kim. Thank you, Gina, for joining us today.
Venish, nice to meet you.
Thank you. We also have with us an endocrinologist, which is Dr. Nichakarn Lachitai, who's an endocrinologist from one of the largest tertiary care hospitals in Thailand, which is the King Chulalongkorn Memorial Hospital. Thank you, Dr. Nichakarn, for joining us today.
Thank you, Pinesh. Nice to meet you.
And from the industry, providing a perspective from an industry technologist who has had a wide experience in digital solutions arm previously as well. We have Arpit Patel, who's joining us, who is the network lead for global product management at Roche. Welcome, Arpit, for joining us. Thank you.
Thanks, Manish. Thank you.
And we also have, providing us with a perspective from the payer, which of course is a very important component in our discussion today, is Dr. Alan Ong, who is a medical director with AIA Singapore. Thank you, Dr. Alan, for joining us for the panel discussion today. Now, without further ado, I will pass on the session to the very able hands of our moderator, Steve, to carry on with the discussion. Over to you, Steve.
Thank you, Benish, and thank you to all our panelists for joining. Maybe if I could start with, and perhaps an obvious place to start with our patients. So Gina, maybe if you could just kick us off in terms of responding to really we've seen a whole bunch of data in the preamble from Benish and Glenda and Peter and Calvin there. Clearly, some key points to take away there. We have 1 in 9 people across APAC today having diabetes. It's clearly a very difficult disease. It has this combination of very high frequency touch points to manage it, but also a very enduring nature, chronic nature of the disease. And in addition, on top of that, some quite severe complications that need managing, some additional conditions that tend to travel with, whether that's hypertension or obesity, that also need managing alongside the diabetes itself. Can you, I guess, taking a patient's perspective, can you share some of the issues, I guess, just to anchor those with our audience today around some of the things that you experience and other patients experience in terms of seeking care and going through that process of managing your own care for diabetes in general?
Okay, thanks for the question, Stefan. So I'm currently living with type 1 diabetes for 16 years now. And as you guys all know, since my insulin producing cells are killed off, it is really vital for me to administer insulin via an insulin pump, injections, or what insulin pens. So in order for me to know when I need these injections, I have to monitor my blood sugars by pricking my fingers and testing the glucose level in the blood 4 to 10 or even more times a day in order to ensure that the level stays within a healthy range. So it sort of became my daily routine ever since my diagnosis that I have to check my blood sugar and then do the injections. So it is very exhausting and time-consuming disease because you have to do something about it very frequently, you know? So like just Benish share in her slide, like it's like you have to do something like every few minutes. And in that sense, I think the diabetes is very different from other chronic disease in terms of the management piece, because it is not a disease that you just go see your doctor and they can do something about it. It's about the disease that you have to, or your caregiver have to take care of it in your everyday life. So I think it is fair to say that it's one of the most complicated and most existing chronic illness because it goes for a lifetime and it changes minute by minute. So basically we call it 24/7, 365-day-a-year responsibility. And still I have no vacation time from it. So it's hugely intensive and complex condition that requires ongoing care to sustain a good sugar level. And in addition to that, you mentioned about the complications. You know, we always have this fear of having a complication. Diabetes is not really about, you know, anything, but it's just you have to really prevent the complication that's about it. So I think it's really important for people with the disease to regularly follow up with the endocrinologist on a regular basis. So there's so many things going on, in addition to the checking your blood sugar and do the injection. You know, you have to go see your endo to see your kidney functions fine, you know, if you have the DM food or see your eye doctor, there's so many things going on. So in that sense, I think it's really important for me to do the regular checkups. So especially during this pandemic, particularly very beginning of the stage, I was really having difficult time to see my doctor. And because during this pandemic, it was so scary, you know? And so I just wanted to have more supplies or more insulin just in case if something happened, you know? So I wanted to get more supplies, but it was so hard to get it for me because in Korea, we don't have the telemedicine here. So I have to go physically see my doctor. So it was really challenging for me to go walking into the hospital and get the prescription for my supplies because, you know, it was so scared to have it. And I didn't want to risk my life to go into the hospital and see my doctor because at the very beginning, everyone got so scared of it. So, so I think it's just that was the moment that I was really in desperate need of the telemedicine. But unfortunately, we don't still have it in Korea. I mean, there is some good point that the COVID actually really accelerated some of the emergency reimbursement telemedicine consultation, but still it's just not really officially approved in Korea, so that I cannot really fully take advantage from it. So I think that is the most of the major issues that I was facing having this disease. Thank you.
Thank you, Gina. It's always amazing hearing it through the voice of an actual patient. So thank you for joining us today. I think it's also astonishing just how COVID has changed some of the working practices, and I think we'll come back to that. Clearly, how that has all happened, how COVID itself has played out, and how that's affected care really differs from country to country. So it's very much a local disease. As a current resident of Shanghai, I know just how awkward it can be to access care in the middle of a COVID outbreak. We'll come back to you in just a minute, Gina. Thank you for your input there. Let's move on to the next person in the value chain, essentially. So we'll move on from Gina to our representative of the healthcare community, Dr. Nichikan. Thank you for joining us today. I guess we've heard from Gina already some of the complexity from a patient perspective of managing their condition. What do you hear about in your practice around the issues that patients run into in managing their health? And I guess if you could expand a little bit on what kind of operational challenges that creates for you in terms of managing a practice that really adds value to patients' lives.
Okay, thank you, Steve, for the question. So I believe that both patients and the healthcare providers are affected by different challenges and issues. So start with the patient point. That's like a fragmentation of service. What I am always hearing complaints from my patient is they have problem with diagnostic process, the establishment of care with the healthcare providers, the access to diabetes education service, especially by the telehealth system, that we don't have like a proper setup of teleeducation here in Thailand also. And they have problem like referral to a specialist and a lack of system that support diabetes self-management, like Gina already said. And I think the reimbursement issues and insurance coverage is one of the most significant pain point to like access to diabetes care as well. And from the healthcare provider standpoint, so we all know that we have wide range of digital tools and capabilities to do that. We have like connected medical device, decision support software, remote coaching programs, and advancing data analytic programs. But healthcare provider, including me, are still unsure about like the best way to leverage our diabetes ecosystem. I think making use of all these resources we have remain a challenge for us. For example, I have a patient who has a glucometer that linked to the applications. If I want to see the patient glucose data in the medical record, I must first log into the clinic account, then I upload the meter, I export it to a PDF files, and I need to attach it to the EMR. So as you can see, it requires like extra steps and extra work for the healthcare providers. And also another big pain point is there's a lack of operational interoperability between devices and software. Like we have 5 or 10 different passwords and username for each separate platforms. And this like a significant challenge to the clinic workflows, and it limits the time that we can spend on our patient so we have to spend it in the computer instead. And also there's a lack of EMR integration. Like right now, like the protocol is just we download the data and we got the PDF files, and it's like many incompatibility issues. So sometimes we are forced to just like cut and paste the glucose and insulin data in the EMR. And I think that limits the retrospective analysis in terms of the patient individual need, or like if we want any data, like a report for the payer, so we can do a detailed analysis on that. And it can contribute to clinician burnout as well. So I think, in my opinion, I think we need a universal protocol that can transferring data from people with diabetes to the healthcare provider in like a standardized and easy interpret format.
There's a lot in there. Thank you, Doctor. I think I guess the two thematics that I'd take out of your response is really around the need for integration. And I guess you really focused on the data and systems aspects of this, which is helpful as we're talking about sort of care coordination today. But also not just integration, but also the interoperability aspects of this. So at the moment, different standards, exporting to PDFs. It's like where we were with a lot of our IT systems before the 2020s came along, and everybody started trying to stitch this together. So we've got a bit of catching up to do in the diabetes space. I think that's true. Actually, NEK works across a lot of different subsectors within healthcare. I think that is true in a lot of different subsectors of healthcare and a lot of different specialties and disease areas. But just given the uptake of and the data generation that exists around chronic patients such as diabetes patients, it becomes a real issue if you want to actually use that data in this case. Thank you for that. So let's we flagged some challenges. The industry, I'm sure, is not new to some of these are not new to the industry. Let's turn for a moment to our third panelist, Mr. Apec Patel, who's got some ideas and is well plugged in across the different levels of innovation across the whole of the diabetes industry in APAC. Maybe could you share some, I guess, some perspectives on the recent service innovations that you've seen coming across the industry? So where have medtech companies been able to contribute to solving, I guess, some of the issues that we've heard highlighted by Gina and Dr. Nichikan?
Sure, Stephen. First of all, thank you very much for having me here, and I'm really happy to see that all the relevant stakeholders are involved to talk from their own perspective to form this consolidated consensus on the the opportunity, challenges, and the path to progress with the care coordination services in diabetes management. So thank you for arranging this. Go to Apec Net Association AVT Consulting. So Stephen, now some of the answers to this a broad topic on the innovations at the very large are and very generally speaking, when we talk about the innovations on the digital health and technological advancements for people with diabetes, and as you mentioned that it's now a reality, which was not a case a couple of years back. And it's beyond just using the mobile health applications, which some of the users or the people with diabetes are more comfortable using over the others. But it can be also a very basic, like what we all have seen and witnessed during the pandemic and the lockdown, that both people with diabetes and doctors, they have adopted a very simple technology such as a video consultations or sharing data digitally, sharing e-prescriptions or the ordering of medications via e-pharmacies, or together we call it as a remote patient monitoring services. And as per me, it completely changed the awareness as well as the acceptance about the digital health from both the sides of the patients as well as the doctors. Now, maybe speaking about the innovations, most of this are mainly focused towards managing the complexity of the conditions. Since we spoke a couple of times that a person with diabetes, they need to make so many decisions on any given day, like what to eat, medications, the exercise, SMBG or glucose test to be done, and at the same time focusing on her or his job or the business and the family priorities. So if I talk about service innovations for diabetes patient care, what we have now, and this is a reality, is the integrated system with both the hardware as well as the software, and not just the software as such. And it is a kind of the integrated system approach, or we call it as IPDM, which is integrated personalized diabetes management, which mainly focuses on how the data generated, right? An example from the blood glucose monitoring category is how the glucose is measured, how the glucose data is systematically recorded, that gives enough insights to the patients on what is going on inside the body, and then how the data is transferred to different devices and the stakeholders like the doctors, diabetes educators, hospitals, EMR systems, and also caregivers. And then basically how the data can take a shape of some trends, patterns, which means that how the system can analyze and process the information, which can help the decision making, is the level of innovation we have already to facilitate better care, coordination and support for diabetes patient care. Also, maybe a couple of more to add. We know diabetes management, it represents a complex intervention, and advancement have been made on the digital technology side in the simplification of the complexity. And essentially because the diabetes management is individualized, the role of an additional services to manage this complexity is a key. And here some innovations on this lines to improve care here are the coaching services via a diabetes health educator, either via a virtual 24/7 artificial intelligence powered health coach, or a human health coach, or the combination of both. And open connectivity with several other devices and the care services. We have smart insulin pens, or the glucose strips home delivery services as part of the standard bundles are some of the more examples of the service level innovations here. But it is indeed touching to hear about the challenges faced by the patients and HCPs, as highlighted by the Gina and Dr. Nishkan earlier. But yeah, Stephen, it's also important to hear from you and your perspective as well on what do you think about the service innovations to help lessen the burdens of those challenges mentioned by our panelists.
Yeah, thank you for that. I think hopefully people can see the page, the graphic that's up on screen now. I guess this is the way that we at LEK have tended to map out some of what's going on in the industry, at least around service innovation for diabetes. It's interesting that there is a pretty strong correlation here between the areas of interest that were flagged at the start in the polling at the start of this session, and some of what at least is going on that we see going on from a technological development and innovation development perspective here. So for example, around the earlier identification of patients, we've seen detection algorithms, whether that's in sort of standard wearable devices, whether that's in advanced wearable devices for risk populations. We've seen some movement there. Of course, we've always had certain capabilities around the diagnosis space, but importantly now we're also seeing, as we think about some of the thematics that Peter was highlighting earlier, around, I guess, empowerment of patients, control around their disease, and communication with their practitioners. Some of the treatment and ongoing medical, ongoing management sort of applications and devices, and the smartness and the interconnectedness of those has really taken a leap forward over the last few years. And much of that is now available in our diverse APAC region. Clearly, getting through all the market authorization pathways that exist across the region can be a bit of a hurdle, but much of that is now either here or is coming. I guess there is on top of that a further base load around some of the platform type services and capabilities that diabetes is actually fundamental to supporting and driving. So we also think about things like telehealth and prescription services as being really fundamental and broad-based across lots of different conditions. But clearly, as we keep coming back to, there's so many diabetic patients out there that actually most of those really do focus on trying to serve diabetic patients and serve endocrinologists and the ecosystem here, because it is so important, so prevalent to be able to serve those patients. They represent an important opportunity for those platforms, as well as an important source of users. Let's come back to what some of the challenges, and I don't want to go into a very dark place with this webinar, because so we'll come back on what are some of the success stories in just a moment. But the clearly against that backdrop of sort of technological development, it would be great to hear from our panelists, I think, around some of the things that need to be changed, what needs to be addressed to foster the development of some of those services, some of those technologies through healthcare ecosystems, through the region. Maybe Dr. Nityakan, can we come back to you first on this, as to, because I think clearly most of the issues come back and pivot through our endocrinologists at some point. So maybe if you could start on just saying, well, what do you see as some of the issues in taking on some of those exciting developments?
Yeah, I think the first thing that needs to be addressed is the healthcare provider education. I think because like sometimes, in my opinion, medtech companies and healthcare provider doesn't really work together. So I think there should be more like collaboration between those two parties to direct the way to develop the care coordination system, especially in people with diabetes. And also there are still some like a misconception among healthcare providers. For example, if I say diabetes care coordination system or teleclinic, most providers just think of like a telehealth system that replaces a clinic visit with a televisit. And what they don't realize is that that's more complicated than that. So we can use like a variety of tools to coordinate care. We have like a connected glucometer, a smart insulin pen, a remote patient monitoring system, and telehealth is the only one of two we can use. But this is kind of like not generalized idea among healthcare providers. And also, I think reimbursement issue is extremely common. It's extremely important because many healthcare providers, I believe, are kind of hesitant to invest in technology because it requires extra work, extra step, extra time for that, and the investment might not be reimbursed.
Yeah, we've got some thorny issues for Dr. Alanong to deal with in just a minute. Before we thank you, Dr. Nityakan. I think before we move on, Apec, maybe can we come to you next, as I guess as a representative of some of one of the leading developers of that ecosystem from a technological perspective. What do you see as the issues?
Yeah. Thanks, Stephen. I totally agree with what Dr. Nityakan has mentioned. And I have personally conducted many interviews and some of the advisory board meetings with doctors. And for them, since they have limited consultation time available, they cannot use multiple of systems during the patient visits. So for them, it would be beneficial if everything is at one place to avoid complexity for them to manage, multiple accounts, user IDs, etc. So interoperability of the cloud-based data sharing capacity is one of the area which can be addressed. And of course, these are the systems with open connectivity available now, but the same can be scaled further so that the data from various solutions can be together at one place to provide the holistic information for better decision making and personalization, which is something will definitely encourage the behaviors towards the greater adoption. Second one sounds a bit more basic, but also it's an important issue, which is like a regular training to effectively use the services. And this is both from the patient sides as well as the HCP side. And some of the needs, again, after talking to customers, are as simple like an educational workshop to their support staff or the admin staff or diabetes educator who then can effectively use those solutions, and it has to be repeated and not just one time, which will of course help in increasing the adoption. And also, while I talk about the support staff or diabetes educator, I should also highlight that in many of the Asian emerging markets, we do not have this additional, we call it as a diabetes nurse educator, who can play a very important role in the entire diabetes management ecosystem, and also in the adoption of this digital health services. Maybe one more, last but not least, in terms of the issues, is about the data management. This is, of course, a very large topic, and we may need probably a longer time to discuss around this. But the challenge here is that the countries, they have a different needs in terms of the, the data hosting or the storage or the processing guidelines. And even in the same country, different hospitals may have the different regulations, and this is the barrier to adoption. And this is a topic, which is emerging, and many countries, the regulations are not super clear, and sometimes it is, frequently changing. And this, of course, is one of the barrier for us to scale up of the services, and this is not as fast as we from the medtech company we expect to be. So maybe a summarization in the, maybe the adoption ladder, which starts with the initiation by just deploying a digital solutions after years of research, and then there is an optimization stage, and then it comes to a sustained use stage. For us, it's very important to focus. It's not just on the initiation, but also optimizing by simplifying and adapting the changing customer needs, and also by building a value over a period of time for the long-term sustained use. So maybe this is how I would see from the medtech industry perspective, Stephen.
Thank you for that. Yeah, we certainly see the collision here between essentially very large scalable solutions that the industry can deploy and that patients can engage with, and highly localized, essentially, data regulations, whether that's down to, as you highlight, down to the individual hospitals' level of sensitivity around how they handle data from their patients, or even down to sort of sovereign states thinking about data security and data nationalism. So it's definitely a complex issue as you think about the breadth of what's going on across APAC markets and diversity of that regulation. Gina, in our previous conversations, you talked a lot about medical data and community building. How do you think about these issues of driving uptake as a patient? What's stopping you getting your hands on some of these things and running with it?
There are many things, but I think maybe from the patient's perspective, the out-of-pocket expense from patient end that really needs to be reduced. So there are really good products out there, but still patients cannot really afford it. And even though they have a good medical access with good technology, they cannot really fully take advantage of it. So that's really unfortunate. And also some of the things that the Dr. Nichikaran mentioned previously, the data integration within the patient and the hospital. Sometimes whenever I go see my doctor, it takes forever to upload the data because the firewall at the hospital sometimes doesn't allow the access from the specific brand of the brand. So it's just, I have like 3-minute outpatient time, but I'm spending all of that in order just to get the download the report. So that's just really something that's stopping me from, getting this access. And I previously
recent users of video conferencing, I think we can all engage with that point.
Yeah, sure. But I think what I'm most rooting for is the telemedicine still. I've been experiencing this horrible situation during the pandemic. So I do still feel that the telemedicine is really essential for this particular disease, So in Korea, we recently started the pilot emergency reimbursement telemedicine consultation. So we can still get the prescription without going to see doctor, but it's just still just we're doing the pilot. So I'm not really happy about it because I don't know if it's gonna be sustainable or not. So it is true that this COVID situation increased the access for the care, but still it needs to be more become more official, I think. But there's still a lot of barriers to that, because there's a lot of stakeholders, you know, maybe the doctor association or the pharmacy. They don't want patients to just get the consultation through the phone, and, you know, because it's less likely for them to go to the clinic or go to the pharmacy to get the, you know, medication they need. So they think it's just going to be, you know, less money, but medicine really shouldn't about making money. So that's just really something that I'm really not happy about.
Yeah, so figuring out where are the financial disincentives in the system for change and adoption, and addressing those is a really important part of getting any proposition to fly. I think clearly healthcare needs to be economically sustainable for everybody. That includes patients, it includes the healthcare providers, the physicians themselves, and the suppliers into that ecosystem as well. It also needs to be financially sustainable for the large payers of the ecosystem. So, Dr. Allen, you've been very quiet so far, and I'll call on you now. I guess we're seeing lots of discussion here around sort of affordability of some of these solutions. Clearly, it would be nice if everybody's insurer would step in to help with this. What maybe you could elaborate how to think about this, and what's going on in terms of from the perspective of a payer. What are the considerations? Let's just lay out, maybe to start with, what are the considerations here that really that some of these solutions are running up against?
Yeah, sure. In my day job, I field a lot of calls from medtech companies, pharma companies, and so on and so forth, asking about how you can get reimbursement for your particular product. So essentially, the response boils down to this, right? In healthcare financing, you always have to make trade-offs between cost, quality, and access. You can't achieve all of these things simultaneously at the same time. From a practical perspective, as an insurer, what we need to do, and not just insurers, any third-party payer, whether it's insurance or government or anything else, what the payer needs to be able to do is to balance the inflow of what premiums you're collecting with the outflows of what claims you're paying for. So whenever there is a proposal on the table to expand coverage to include a particular something, what the insurer has to ask themselves is, if I expand this coverage to include this particular something, can I still keep the premiums and the claims in balance? And there are really two ways to balance that. One is maybe if you expand coverage to include, more services for diabetes, then you'd find cost reductions down the road because fewer people would develop complications, and then you reduce your claims in some other way. So that's one way you can balance the situation. The other way in which a situation gets balanced is, if you expand coverage, maybe that makes your insurance product more attractive. You're able to price it higher, and therefore get more premiums in order to cover the incremental cost. So that's really the basic math that an insurer needs to go through whenever we're thinking about trying to expand coverage to any particular service or any new kind of condition. There are several ways in which insurer will try and figure out whether this balance can be struck. I mean, obviously, we look at the cost effectiveness data that provider is able to give us on any particular service. We'd also be looking quite often at guidance from the government, especially in Singapore. We have the Agency for Care Effectiveness, so we'd be looking very much at guidance from institutions like that to see whether a particular kind of treatment is cost effective and whether it would make sense for us to finance it. There is also a certain tendency to try and follow what is the norm. So if something is considered fairly mainstream kind of medical service, then there's a higher chance that the insurer will be quite happy to reimburse that simply because it's mainstream. And if you don't reimburse it, it would be strange. Whereas for things that are newer, which are maybe not so mainstream at this point in time, you will find that insurers tend to be quite cautious about reimbursing. And The reason why insurers tend to be very cautious about reimbursing new things also is because it's very easy to expand reimbursement to new items. It's very, very hard to take away benefits. You get everybody has, we all know about this phenomenon of loss aversion. So if you get a new benefit, it makes you happy. But if you lose that benefit, it makes you more unhappy than the happiness that you initially had. So we're quite cautious about trying to avoid situations where we have to expand a benefit because we thought it would be cost saving, or we thought we could price it in, and then we have to roll it back because it turns out that actually it didn't achieve the cost savings that we thought it would. I think in terms of where insurers would like to focus on when it comes to chronic diseases like diabetes, probably 3 areas that you gradually see movement in. The first is in the area of prevention. I mean, it's definitely very important to manage people with diabetes as best we can, but from a payer perspective, the highest leverage point in trying to control cost of chronic disease is really to stop people from getting diabetes in the first place. So you have insurers like AIA, we have a vitality program, which is basically all about trying to get people to live healthy, eat more vegetables, exercise more, walk 10,000 steps a day, and so on and so forth, so that hopefully it will reduce the risk not just of diabetes, but all the other cardiovascular kinds of chronic diseases that come in. The second area in which we are quite interested in, because we think it has potential to improve the cost effectiveness of care, is how we can take advantage of some of these digital health technologies, telemedicine, and so forth, to make it possible for patients to get care delivered in a more convenient way, right? But at the same time with a lower cost structure. So let's take the case of teleconsultation. In principle, if you are doing a teleconsultation service, there are some costs that you don't incur as a result of that. That should hopefully lower the cost structure of delivering any particular kind of the consultation. And hopefully then you can get a situation where if a certain amount of consultations can be substituted from physical to tele, then you get an overall reduction in costs and you get more cost effectiveness for the system.
Yeah, I think we heard from Benish earlier that it was 3 hours of care on average for a diabetic patient across the course of the year. Well, if you make it that much easier to access care and it balloons to 6 hours of care, well, that's you need to find a way of managing that cost increase. I get that. I guess maybe just one quick further topic before we move on. Has COVID, clearly a lot of things have changed in the perception of healthcare as a result of COVID. We've certainly, as consultants of the industry, we've certainly seen an explosion in the demand, both on the patient side as well as on the supply of telehealth services, for example, during the various COVID cycles. And that's gone backwards a little bit now, but it's still on a massively higher baseline. Has, for example, the changes associated with that, just the changes of perception, driven any real changes in, I guess, that risk aversion or the assessment and the consideration of innovative propositions in the payer community?
Yeah, I think COVID has made payers generally more willing to try new things in the telemedicine space. And COVID led payers to reimburse a lot of teleconsultations by necessity, because if you wouldn't reimburse that, then patients would end up simply not getting care, and that's not something that we want to see. One of the concerns pre-COVID with reimbursing teleconsultation was whether this would be incremental to physical consult volume or whether it would be an effective substitute for physical consult volume. If it's a substitute, then I think the reimbursement question is really quite simple. You look at how much it costs and it's substitute. If it substitutes for a higher cost thing, it makes sense to reimburse. If it's incremental, then you've got to ask yourself the hard question of, okay, will this save you future claims costs because patients better managed, or will you be able to price this in because it's a more attractive kind of proposition? Fortunately, I think the experience during COVID, at least from what I've seen from my own company, is that teleconsultations have a reasonable amount of substitution effect. So they reduce the consumption of physical consultations. And I think if other insurers have had the same kind of experience, it will definitely make them more open to reimbursing teleconsultations in future.
Thank you, Dr. An. I guess let's turn to some of the positives. So we spent a long time on talking through the some of the challenges and the considerations as we think about rolling out these new services that can add value for patients and healthcare practitioners. What about people who've done it already? So can we share some, and maybe if we could keep it to 1 or 2 minutes each, because I know there's a couple of good questions from our audience that I'd like to get to as well. Around, if I could call on each of you perhaps to talk a little bit about some success stories that you think are really interesting or that the industry can learn from. And maybe Alan, I think you've already alluded to thinking about the earlier intervention essentially as a means to save costs from a payer perspective. Would you like to go first?
Yeah, sure. I mean, I can talk about the AI Vitality program. So Vitality is basically a program which we run for our insured members, where we try and get them to adopt healthy lifestyles. The core pillars of Vitality are to help members, first of all, to know their health, which means get them to do regular evidence-based health screening, get them to improve their health, which means we have an incentive structure so that if you hit your health targets, you hit your steps targets, you hit your weight loss targets, we'll give you points, and those points will then allow you to get rewards or get insurance premium discounts and so on and so forth. And then the third part, so you get rewarded. So you get the points, you get status, you get premium discounts, you get to redeem a flight to London or what have you. The whole idea of Vitality was twofold. One is we want to be able to intervene in the journey of our policyholders from day one, rather than waiting for them to develop some illness and then we have to pay out a very large claim. The second idea was, if you think about how most people interact with their insurers, it's basically a negative experience from day one until the day that you hopefully have a claim, because you just keep paying premiums, can be in the thousands of dollars a year for many, many years before you see any benefit. But with Vitality, we try and flip the script. So we try and make it such that from the first day in which you begin your relationship with us, you have a positive experience, you get points, you can see rewards coming in, and then that creates a different sort of engagement between ourselves and our customers, which also has financial value to us.
Thank you, Dr. Allen. Gina, can we come to you next? What do you experience that seems to work for you?
I think as a patient, because most of the patient there now it's really common to use a lot of good medical devices. So I think the good connectivity with my device to the other application is really important, because for some app they integrate with your insulin pump or your smartwatch or other high-tech tools that you may use to manage your diabetes, and these can be really time-saving and enhance the patient managing their diabetes or other conditions. So for now, I'm looking at my blood sugar using my watch, that kind of little connectivity is it's a huge difference that made to the patient. So I think patients are really into that kind of high-tech tools that can really help them to manage their diabetes in a much easier way. And also some of the user-friendly features when they're using the medical device, in the past we have to, in order for me to give the insulin to myself, I have to take out my pump and I have to enter my carb unit in order to give myself insulin. But now there's a lot of good initiatives that they're trying to get this approval to give yourself bolus the medication using the application remotely. So there was been a security issue, but still this is where the patient wants. So they're I think it was really good initiative that the patient was really appreciated.
That's good to see. Thank you for that. Apec, are there particular success stories that you'd highlight?
Yeah, sure, Stephen. I can share the, an example of the success in terms of the outcome improvement in the service delivery to people with diabetes, which is by integrating the hardware devices with the digital solution. And this is an example of achieving a better blood glucose control by using a mobile health app in Asia, a retrospective real-world evidence with, a My Sugar diabetes management health app, which is the most popular diabetes management app in the world, and the earlier data which showed a significant improvement of blood glucose after the 6 months of use, but there was some underrepresentation of the Asian markets in the data. So the objective of this retrospective real-world evidence was to see the impact of My Sugar logbook on the blood glucose control. And in this study, the impact from the first month compared to 6 months been analyzed in approx 1,700 Asian My Sugar users, and the results are quite significant. And if I just quickly highlight maybe one that, in the uncontrolled diabetes where the estimated HbA1c is more than 7, at the baseline, it reduced to 0.5% at month 6. And it has also improved the other parameters like the testing range, high blood glucose index, and others as well. So what this data shows is the improvement in the blood glucose control in those with higher HbA1c in the users who are regularly engaging with the mobile health application My Sugar. Maybe one more insight is that My Sugar offers both the manual data update as well as the automated data transfer from the connected meters. And it's also been observed that the positive impact on the connected devices, which My Sugar directly transfers, and those who are connected with the connected devices, those achieve the higher retention. And this shows a very positive impact on the the connected blood glucose meters and the mobile health apps supporting diabetes management. And this got presented in the IDF last year.
Thank you, Apec. There's clearly there's something in there when you can see the outcomes that are different, that are so significantly different now. And perhaps finally for this question, Dr. Ninchikan, what do you think works?
So I'd like to share my experience with our hospital advanced diabetes management clinic and diabetes telehealth clinic. We've been running these two clinics for almost 2 years now. So in advanced diabetes clinic, we provide a service to a patient specifically using an insulin pump or continuous glucose monitoring. We have like a diabetes nurse who specializes in pump and CGM downloads issues and everything. And in diabetes teleclinic, we use integrated personalized diabetes management program. It's a care model that combines the connected device like the BG meter, CGM, a remote support by telehealth system. And we conduct tele follow-up, tele education, and blood glucose interpretation and structure feedback. So we've been running these two clinics for 2 years now, and we conduct a preliminary analysis of our performance after 1 year. So we analyze the data around like 100 patients, and we found a significant improvement in the clinical outcome. For example, we found that the average A1C before going in the service was 8.2, and after 1 year of telehealth follow-up, the average A1C reduced, and it's around like 7.5. And the questionnaire is about quality of life, and the patient satisfaction is overall improvement, and the patient really loved the service. And also, this service also reduced face-to-face visit by 500 visits in a year. It might not seem that much, but this is only our pilot study, and we plan to expand our service once we have more resource and support from our hospital.
Again, some pretty impressive outcome data there. I hope Dr. Ellen was listening. I think let's move forward again. Thank you for those success stories. It's great to hear what can be done when there's motivation and an interest to do that. I guess we've got a couple of really good questions from our audience. Maybe I'll throw those into the mix here, and then before we wrap up. So first question. Let me just bring that up. So I think we've heard some success stories here. There are clearly a lot of different particularly applications or software only type systems out there. What do you as participants, patients, clinicians think is some of the things to look for, or particular applications that are how to spot a winner, essentially, is the question, I think, in all of that noise, basically. And perhaps if we could start with Dr. Allen and come back to maybe Dr. Nitchikan on that one.
Yeah, I think you've probably got to think of 3 dimensions when you're trying to figure out what is going to have big impact in this space. So number 1 is whether this is something that patients will tolerate, because at the end of the day, it's patients that have to use whatever service or device or whatever it is that you are offering. So if it's difficult for patients to use, or if they don't find it very tolerable, or if it's inconvenient, then probably won't fly. Number 2 is whether you can convince healthcare professionals to use it, or to encourage their patients to use it, because healthcare professionals are the key point of influence in the system. And if you can't convince healthcare professionals to use it, you probably won't have very much luck trying to convince patients to use it. And number 3 is whether you can make a reimbursement case for it, whether you can convince payers that your solution is something that is cost saving, or if it's cost increasing, it's at very good incremental cost effectiveness, so that from a payer perspective, we can make an argument that it's worth reimbursing this new service.
Yes, and I agree with Dr. Allen. The most important thing is anything that's easy to use. I mean, it's useless like if you have like a super complicated application or platform. So the patient might be able to use it in a user-friendly way. And the second important thing is interoperability. I mean, I struggle a lot with too many platforms right now. And the third important thing is anything that we can have support, like for both like IT management and the infrastructure and all the stuff for the clinic.
Thank you both. Probably on a related note, actually, there's a question about effectively there's clearly a lot of data integration, data interoperability issues that would help both patients and providers to be more efficient and better served. Clearly, that runs up against, in a lot of jurisdictions and a lot of hospitals, that runs up against data privacy and security considerations. Where do you, I guess, perhaps to slightly confine this a little bit, where have you seen that well managed? So are there particular jurisdictions or particular situations where you think, yes, actually that was the right balance, and both from a regulatory and a patient privacy perspective, and perhaps Apec and Gina, if I could come to you on this question.
Sure, Stephen. So yeah, it is a complex an environment, and there are a lot of regulations around there. But as you specifically asked about the right balance, what I feel very shortly that the consumer must feel or the users must feel very, very comfortable with how their information is used, right? And they want some control in the process. So how we can bring more confidence to the people with diabetes, and we can win the trust of the users that so that the privacy issues cannot remain as a main barrier in the adoption. So here is something which I can think would be right balance to gain the trust of the users on how we collect the information, how we use the information, and also give overall control to them. So that's something which I can quickly think about.
Gina, we started with you. Let's end with you.
Okay. So I think from patients' perspective, we don't really think that the data privacy is a big thing here, because as long as we get the good medical access, you know, as long as we get whatever we want at the clinic. I think that's what patient really wants, not about the privacy, you know. So yeah, that's just something that I can share.
That's a great perspective. I'm conscious we're right up on time. Can I have a one-word answer from everybody on just what can you do? What could payers or patients or providers do to help support this environment, to support the development of these kinds of services? And then we'll move straight to closing. Calvin, you've been very quiet since your fireside chat. Perhaps I can start with you, and we'll run through the panelists in a moment.
Yeah, sure. I think one key thing that we've taken away, I think, is a lot of like that collaboration around that public-private partnership. I think there's a lot of value that the private sector can bring, and we've seen that across like various chronic disease management, and that is an area where a lot more collaboration across stakeholders. So the key thing is collaboration across stakeholders would be important to drive forward some of these service innovation.
Thanks, Calvin. Gina?
I think as a patient advocacy group, they really need to speak up our voices so they can be part of the discussion, you know. And also, like, this is pretty much like a wrap up of what I've said. It's just a telemedicine implementation and some of the integration for the data between the clinic and the patient application. Yes.
Speak up on what you need and why you need it. Yeah. Dr. Nichikan.
As a healthcare provider in academic center, what I can do is I can do research, you know, to generate data that prove that this kind of system works in itself. It's called effectiveness, and maybe one day the data will be enough to persuade all the payers to support the system.
Thank you, Doctor. Sounds like there's an opportunity there, Apec. What do you think?
Yeah, sure. The role we can play is by designing the value-based healthcare to improve quality of care. And this includes, you know, like how best we can design the healthcare system, how we can incentivize the good patient behaviors, how we can eliminate, you know, different silos we have within the interoperability and make it more meaningful with integrated personalized diabetes management.
Thank you, Apec. And Dr. Allen.
Yeah, I mean, I think the opportunity for payers is really in trying to think through how we structure reimbursement so that we encourage the use of more cost-effective interventions. And typically, these are interventions that are upstream in the prevention space, in the early detection and early intervention space.
Thank you. And thank you all, I guess, just to wrap up quickly and pass back to our hosts at AdvaMed. Just wanted to say thank you very much to all of the panelists and to both our fireside chatters. I think it's been a really good discussion today. There's been a lot of interesting insights shared, and clearly great to have a sort of 360-degree view of the ecosystem. So thank you all for joining us today, and thank you to our audience for coming through. Glenda, back to you.
Thank you, Steve. So I think today we started out by recognizing the constraints of health services today. Dr. Alan Ong mentioned the challenges of cost, quality, and access, and you continue to struggle with this trilemma. And with the role of MedTech, with technology and the culture of innovation into the paradigm, there is an opportunity for us to reshape collaboratively with our patients, with our healthcare professionals, to really go direct to the consumer, to really integrate and synergize, you know, the point solutions into a end-to-end service that complements the existing healthcare systems. And integration, right, was a key that Dr. Nichikan, Dr. Alan Ong, and Ms. Gina mentioned over and over again. And I think Arpit also highlighted the need for, you know, trust and technological advancement to really address some of these gaps that still exist in localized markets. But technology is scalable, and we believe that through collaboration with our stakeholders, we can shape the next phase of healthcare services delivery. So with that, thank you very much again to all our speakers. We are really grateful for your time today. Let's connect, get in touch, and see you in the next phase. Bye-bye.